So my workshop was around young carers and health, and I think the three key takeaways from the workshop today was about the importance of identifying young carers, but also not just identifying them for support, but also recognising actually young carers are often the experts as to what's going on at home, but they've also got lots of unanswered questions. There's a young carer who so powerfully said about actually she's the one who has to understand what happens when medication changes, and if you forget about that, that can be really detrimental for young carers. And I think the final takeaway is about thinking about the impact on young carers' own physical and mental health, and thinking about what can you do on a day-to-day basis to improve support for young carers through data, through your local strategies, but also awareness raising for staff as well.
A really interesting reflection about today is how everybody enjoyed my lesson learned, which was just go for it, go a bit rogue, try something, use a bit of QI methodology, but be brave, and that really resonated with people, didn't it?
I completely agree. If that's the takeaway message, be brave. Carers are a health crisis hiding in plain sight. It's all of our responsibility to support them. It's potentially something that we're all going to be affected by. So be brave, be bold, and just go for it. So for me, identification of carers is everything, and in order for all frontline staff to be carer aware, you have to have a system of training. We've operated through stealth and going to meetings and forums and using practice development forums to cascade knowledge about care identification, but for me it has to be a mandatory requirement upon all staff. What do you think?
I think that really came loud and clear with the people who are attending the workshop as well. It's not mandatory training in so many trusts, but it absolutely should be top of the agenda.
It's everybody's responsibility.
Yeah.
Go. All right, Jo. So the reflections from that workshop around how the acute sector is supporting carers through hospital discharge. For me, it's around the importance of knowing what data you're collecting from the outset. Because if you don't have hard metrics around time saved, packages of care, support that carers need, and how the scale of the demand, it's really hard to prove your concept and get funding that's going to be sustainable for the long term. What do you
Definitely, and I think that really came out in the questions that people were asking. So your data is much more in depth than my data that I've collected at Carers Corner. But if I didn't have that low-level data about the number of carers that we've liaised with, we wouldn't have the support of the board, and the service that we're providing wouldn't be sustainable moving forward. So I think it's just been really fascinating that two different approaches to collecting data are still equally valid and important.
So could you just share with us your 2 or 3 key takeaways from your presentation today?
Hi, my name is Anne-Laure Chacon, and I am the CEO for Bristol Black Carers. And the 3 takeaways that I would like for the delegates today is, 1, is for us to see people as individuals and not diagnoses. And once that is done, we will not be looking at health inequalities, but we will be looking at equity and being able to give care as required by the individuals. 2, we need to work together more in terms of all the factors that give us life: housing, education, employment, finance, and emotional support should be there in taking the holistic approach to helping carers. And 4, everyone is a carer, and caring is everybody's business.
Hi, I'm Emily Holtzhausen, Director of Policy at Carers UK, and I have had a very rich and rewarding day today at the NHS Commitment to Carers conference, where we've been looking at local practice and leading locally. So my session was on integrated care systems, strategy and engagement with carers. My top 3 takeaways are: the first, don't forget that the Integrated Care Board has a legal duty to involve and engage carers. Make the most of that. We want to see carers properly mentioned in the ICS strategies, some of which are still evolving and being delivered. The second thing is that partnership really matters. local authorities quite often have known about carers and have done excellent work on carers, and that we want to see that mirrored across into the NHS, where we see true partnership and collaboration. And the third is really empower carers and use their lived experience to make life better for carers. If we do that, life will be better for everyone, and the systems, NHS, social care, and of course the people who need health and care support as well.
Could you share with me your key takeaway from today's session?
So I'm just really excited by the skill and expertise in this network. We need to share more. Wonderful work about discharge, stuff around carers' strategies and things that aren't routinely happening, but we could all learn from and do much better.
Could you share with me, Kevin, please, your key takeaway from today?
Partnership. I think working together and as partners to solve the complex issues that face carers is imperative. And we need to join up our forces in terms of mapping the data to recognise the inequalities that carers face and take targeted interventions and deliver real impact and change.